Hi everyone, we are starting today March's Ask the Derm. So for those who aren't familiar with it, Ask the Derm is a format that we've developed here at Fargo Center for Dermatology to answer questions from some of them are patients and some are just people that are following our social media. And we want to give everyone access to be able to ask those questions if they don't have an opportunity to visit with the dermatologist. So these are some questions that were submitted this last March on our social media. So I'm going to dive right into it. And these are just questions, and I often find that questions that one person might ask are typically questions that many more people are actually thinking about. So our first question of Ask the Derm for March is, what is the best facial moisturizer that includes SPF? Love that question because that means that person asking that question is really caring about their skin. They know they need a moisturizer, which is really important for to prevent premature aging and just to look healthy and look youthful in your skin every day. But then also they're going above and beyond that, and they want something with an SPF. So SPF is sun protection factor, so that means they know that the importance of protecting their skin. So that's a really great question. One of my things that I always say is that there's so many great options that are out there. And so a lot of my patients, I say, just bring it in what you're using. And I'll just cut through that. I'll just flip the bottle around and we'll run through the ingredients with it for you. So in order to get an SPF, you have to add a sunscreen in it. There's two different types of sunscreens. Just to break it down for simplicity, there's the chemical sunscreens, okay? And then there is non-chemical sunscreens. Sometimes we'll refer to the non-chemical sunscreens as physical sunscreens. Instead of naming the whole list of 20 to 30, chemical sunscreens, I tell my patients, I'm just going to teach you the two physical sunscreens or non-chemical ones, and that's zinc oxide and titanium dioxide. Of the two, I prefer zinc oxide, has a slightly better protection, but oftentimes the sunscreens will combo both of them. They'll have zinc oxide and titanium dioxide. They're a little bit harder to find, okay? But if you know you're in this sensitive spectrum of skin, that is what my guidance would be, is find one that has a moisturizer that has a zinc oxide and or titanium dioxide. If you are just an average consumer, you have really tough skin, you can tolerate anything, economically, it's probably going to be a little bit more affordable to find a moisturizer that has more of a chemical sunscreen. Here's the other caveat to that though. I always tell my patients I'm a little bit sometimes apprehensive about combining those two products. I think it's a great way to start the day on an average day. You're running to the supermarket and doing errands. The issue is some of us have really dry skin. It might be winter, we're living here in Fargo, North Dakota, and we need to apply that moisturizer 4 or 5 times a day. We're putting it on before we go to bed, when we're inside. You don't need to put a sunscreen on 5 to 6 times a day, or especially, if you're not going outside right before you going to bed, because you can actually get an irritation from that. So that's why I actually, in the perfect world, I love to separate those two products. I love to have a moisturizer and a sunscreen because oftentimes they're on two totally different schedules. You might be applying your moisturizer 5 times a day, 2 times a day, and you might need your sunscreen at completely different times, okay, on that one. So, plus, most of the time, those moisturizers with the SPF are only around an SPF of like 15 to 30. That's not going to be enough for your lake day, on the boat, you're going to go for a run, you're going to be outside at, I'm doing some sort of recreational activity. So you will need to add an additional SPF product on top of that. So I hope that answered your question, okay, but there's a lot of great options out there. Okay, we've got our second question for Ask the Derm, and it's a good one. It asks for, what is the best product or method to get rid of tiny forehead bumps? So that question, I'm thinking about it a little bit. First of all, the question is, what are the tiny forehead bumps? Most of the time, the little forehead bumps are a couple of different things. They're either a type of acne called comedonal acne, so that's like whiteheads and blackheads. But there's also other really common things called sebaceous hyperplasia, which are teeny little bumps on the forehead that pop up in really that oil producing area. And what those are, just overactive oil glands, all right? And they look almost like a little bit pinky or orangey, but some people can have literally 15 to 20 of those. So we treat those differently. So if it's more acne, we treat with retinoids, hydrofacials, topical products, other types of things to open up that congestion. If it's sebaceous hyperplasia, we'll treat with electrocautery destruction, or we actually take a little fine little needle and we actually destroy and just kind of shrink down that oil gland. There's also another process that's super common on the forehead called milia, and those are these almost like little teeny pearls underneath the skin you'll see in those. And those you come in and we literally just open each one up, and it takes us about 1 to 2 seconds to open up those little milia. And then oftentimes we'll put you on a good skincare regimen, retinoids or something else to help with that cellular turnover with the skin to prevent those milia from forming. There is other things that can pop up on the foreheads. Other things like flat warts, definitely can occur, and we treat that completely different with flat warts. We do different immunotherapies, other topical things for viral processes. So I think that question is what is the best product is, it really depends on what those tiny bumps are, but I think I've given you kind of a good idea what the most common ones are. So you could try some of those things, and then if that doesn't help, coming in and we'll actually just make sure we give you a diagnosis for those bumps, and then we can give you a more specific treatment. All right, we have a fun question. So our next question on Ask the Derm is your office in Fargo expanding? And absolutely yes. So that might be coming from someone who's driven by the building and seeing lots and lots of construction trucks and lots of things going on in our parking lot, or patients of ours maybe that are having a hard time getting through on some of those areas on our heavy construction days. So yes, we're expanding. It should be done on around April 15th. So that's very, very soon. And what we're doing is we're adding an additional aesthetic wing to our practice. So what that means is added services for our aesthetic customers. And we have also, that means added space for our medical wing, because our current aesthetic area that we're doing, our medical team is going to be taking that area over. So it is a great thing for all of our staff and our patients. We are super excited about that we will have some additional square footage, to kind of work with. And I think that's just a direct response in the last, really 2.5 years since we've been in our new space. We've actually already needed new space, and we've been in practice for 14 years. And every 3 to 4 years, it feels like we need additional space. So that's typically kind of been the pace. So April 15th is kind of the day we should be able to kind of move over there. And then look in May. We're going to be having kind of an open house and an event with the Chamber of Commerce to celebrate our additional space and our opening of that. All right, Ask the Derm, next question. This is a really common question. It says, what can I do about my warts? All right, there isn't a day I think that goes by in our clinic when we don't see a wart patient. So this is really one of our kind of bread and butter things that we deal with. And really what that says is it's so common. So I think what I tell my patients first of all is, typically they feel terrible when I tell them I have this, or they feel some sort of guilt on what did I do to get this. I say, you know what, there's so many people out there that have this. This is a really common thing. It's not a big deal. We'll treat it. We'll take care of it. Okay. There's a lot of different treatments. I always tell people, we've got about 10 to 20 different treatment options. That means that not all of them work perfectly, but it does mean that there's probably a great option for you. So it all depends on really your age, your tolerance for, can you do a procedure or can you only do a medication? Or depends on maybe your insurance benefits. Do they cover medications? Do they cover types of procedures? So you can do anything from topical prescriptions. We sometimes work with very traditional topical medications. Otherwise we mix, we do a lot of compounding, mixing a lot of different ingredients depending on what kind of wart you have. We do a lot of removal, curetment. We do a lot of, we do lasers, we do injections, we do immunotherapy, we do canthrone, which is kind of like it's a blistering kind of beetle juice that we use in that area, and we do that for our pediatric patients who don't want any pain associated with it in the office. So that one we kind of reserve for more of our pediatric population. Like I said, we have other things like injectables. The biggest indicator for us is kind of in determining how are we going to treat your warts is how many do you have. Some people come in with 1 wart, and some people come in with 100. So based on that, we treat those types of warts completely differently, because we actually have some treatment modalities that I actually can only treat 1 or 2, and it will actually help all the other 90 warts. So it really just depends. So sometimes with those, we've got to do a little allergy test with you, and it's a multi-step kind of process. But warts are common. It all just depends on what type you have, okay? And then we'll help you make that decision on what would be the best treatment for you. Okay, we've got a really great question on Ask the Derm that most of us, kind of want to hear the answer to, and that is, what is the best anti-aging tip? And so I get this question also many times a day. And really the question is, how can I prevent premature aging? Because you know what? Every day we spend on earth, we're going to be just a teeny bit older than we were the day before. All right. And so we just have to know what are the best ways of minimizing the impacts of each day on earth. All right. So my number one thing is I tell every single patient is it's sun protection. All right. This isn't living in your basement for the rest of your life, because we all want to have fun and we all want to participate in this world, but it is doing sun protection. You'll notice I say sun protection and not sunscreen. Sun protection can be whatever you make of it. Hat, sun protective clothing, finding the shade, avoiding the peak hours, okay? You want to make sure you're avoiding tanning beds. Those are one of the worst things that you can do. All of my patients that are just, potentially they're addicted, they love that feeling of a tanning bed, we really try and get them converted over to spray tans, tanning foams, and that's really the sole purpose of why we added those in our practices, trying to get all those young, beautiful skinned men and women converted from tanning beds over to a healthy tan, which the only healthy tan that exists out there is really a spray tan or a spray type of lotion. So those are two great options. So that's my number one thing. If that's all you want to listen to, that, I mean, you can just stop right there, okay? And then I have other patients that say, okay, I've got that. What's the next things that I can do? And I said, okay, after you master the whole sun protection category, we really talk about, we can do a lot of other fancy things, for you. We, first of all, just be good, to your skin. And so when you talk about avoiding all those other things that accelerate premature aging, quitting smoking is extremely important. They've even done studies where people who stop smoking immediately can start noticing the difference of their skin color. So even though you've done something, maybe even for 20 or 30 years, there's still time, okay? So stop some of those things, minimizing, we're trying to avoid those other pollutants that we have out there. Good skincare, good skin products is also really, really important. Staying hydrated, using a facial moisturizer, something with hyaluronic acid, other plumping things to just plump up your skin, and looking more youthful each day is really important. But the other things, if you want to add something to your regimen to directly benefit your skin, we have different supplements that we put people on for just antioxidants to fight those just oxidating factors that we're all exposed to every day. I always tell people, once you've mastered sunscreen in the morning as just part of your daily regimen, we'll get fancy then. Our next step is, okay, it's ready. Let's add a little bit of a retinoid at night. That is hands down, scientifically, every article says that's the next best thing that you can do to really prevent aging. So we'll add that retinoid, and again, that might be an over-the-counter one that we have, prescription one. We have a retinoid for every skin type out there, all right? And then the next thing is, oftentimes we'll add a vitamin C, and that one we add in the morning. That fights it's their antioxidant that we're putting on our skin in the morning. We also have other sort of growth factors we put on the skin, other hyaluronic acids, other types of things to help with anti-aging. But if you've got to take one thing away from this, it would be sunscreen and a retinoid at night. Be good to your skin, okay? And your skin will be good to you. Okay, we've got our last question for our March Ask the Derm, and it's a good one, all right? It's a question that we get every single day. All right, it says, I do not know where to start with my child's teen acne. Help! Exclamation point. Okay, so it tells me the exclamation point's a little bit of desperation. So this sounds like a mom or dad at home who's struggling. They're watching with their maybe teenage child, struggle with acne. They know it's, psychologically it's affecting them. We get this question every day, and it's not the teenager that's in my office asking this, it's the mom, the dad, the parent, that's in there saying, hey, by the way, I have 1 or 2 or 3 kids at home, they're struggling with acne, what can I do? And what I tell them is, it really depends on what type of acne, because there's no two similar acne patients. Every acne patient has a little bit of difference. Some have comedonal acne, that's the early stages. Some have more acne vulgaris, just kind of the nodules, the pimples, and then we've got the deeper nodule cystic and the scarring acne, all right? And some people have more of a hormonal component. So it really kind of depends on what type, but I always say, hey, first things first, when you're walking out of here, we keep specifically for this reason, just like an over-the-counter acne kit, so they can at least get started on it, something today, okay, while they're working on finding time, because I know all teenagers are super busy. It's hard to find when they can get out of school or come after school, or they've got sporting activities. So I say start on these products. Typically what we're recommending is, a benzoyl peroxide, something with like a salicylic acid, a good cleanser. We've got acne exfoliating pads that contain like glycolic acid, lactic acid, salicylic acid. We've got some good toners that they can start on. We'll often start them on an over-the-counter retinoid, okay? And I say if they are not better after 2 months, okay, bring them in. That means that their acne is significant enough, okay, that they can't get better with those over-the-counters. So there's every patient that tries those over-the-counter products are not going to get better. Some will, and that's wonderful. But if they're continuing to get worse, or if they're getting scarring, I say get them in ASAP. What I always say is acne is actually not that hard to treat, but scarring from acne is super hard to treat. That can mean years of trying to do procedures and lasers and skin pen and other things to try and correct acne. So I love to see my acne patients on when they just start getting their acne, to start them on some preventative things and just getting into some good, skin healthy habits to prevent that. And then the important thing is, I always tell people this isn't a scary thing. This is a very normal thing when you come in. And typically just what you expect is if you fail those over-the-counter things, when you come in, what are you going to expect for your teen? They're either going to be on, typically something topically on their skin, or they're going to be on possibly some pills, for a while or for temporarily, and pills are something they have to swallow, or they're going to be on a combination of those, pills or topical things. Some of my severe patients have to go on something called isotretinoin, which used to be known as Accutane, and that's something they're on for usually about 6 to 7 months, but we can typically, there's a higher than 80% chance that we can cure their acne in 6 months. So what I do give to all my patients is hope, and I say no matter what, don't ever get frustrated. I always have a more aggressive medication I can use, and I got a pretty significant chance I could cure your acne and cure it in 6 months, all right, if we need to, all right. There is another subset of patients who we've got to do a little bit of hormonal therapy, with those, if it's a hormonal trigger with those. So I think the biggest take-home point is start with some of those over-the-counter things that we've given you tips. So either go over-the-counter, buy benzoyl peroxide, salicylic acid, over-the-counter retinoids, stop by, pick up our acne kit. If you're just not sure where to start, just call and book an acne appointment and we'll help guide you. Maybe when you come in, I'll say, no, just go ahead and do some over-the-counter things. Or maybe I'll say, nope, I think we're kind of heading down that path of needing more prescription medications that aren't available over the counter. So biggest things is teens have enough, to deal with in life these days, all right? So I say that if I can take away their acne and the social impacts and psychological impacts of acne and what it does to them, please let us do that, okay, for them. And because I know that life is tough out there and acne is treatable. So I'm giving everyone hope today. And that was our last question from our March series of Ask the Derm. I hope all of you have enjoyed this, and I appreciate everyone for taking the time for submitting their questions because we are really ultimately out here to help all of you. If you are feeling that you've got a question burning in your mind and you want to ask, feel free to just be watching our social media. In April, we'll be we'll be putting an invitation out there asking for those questions. So then please go ahead, log in, submit your questions, and then I will go ahead and answer them in our April series of Ask the Derm. All right, everyone, have a great day.